Types of safety. Somebody will ask, what is safety? Why are you talking about safety? Everybody needs to be safe. I mean, I can't get into the hospital and know that I'm not safe. No, my colleague is not safe. No. Once you are working in an environment, you should be concerned about your safety. So looking at the patient safety issues, we want to talk about medical safety. Medical safety, you have to ensure that even though you are giving a patient medication, it's not also putting an effect on you. We give IV medications, we give inhalations, we give, and in fact, if you want to test an inhalation, you put it into the air. As you stand there, some is getting into you. You are not sick, but at the end of the day, you have to breathe it in. So this is one of the medical safeties that you should ensure. If you are performing a procedure, you should make sure that you don't get a needle stick injury. These are all targets that we give to medical professionals. Surgical safety, as I said before, you should be able to know the correct side that you are dealing with. Ensure that all the perioperative checklist is completed, and then we can say that surgically the patient is safe. We have electrical safety, making sure that all the equipment we are working with in the hospital environment is safe. It is not shocking. Somebody went to touch a light and the person got a shock. This one, you are putting the staff in a very unsafe situation. This is hazard. We also have laboratory safety. In laboratory, there are so many checks and balances that they need to do on machines before they start running tests. And these are things that you should do before the day starts. So in order to keep the laboratory safe, you should ensure your machine is calibrated. You should ensure it has enough power. The temperature for whatever you are doing is okay. These are all laboratory safety. We have sanitation safety. Sanitation, environmental. The pictures I showed you, you see the medical waste is opened, and it is both medical and general. So at the end of the day, we put ourselves in that kind of hazard. If you're a health professional, you have to make sure that segregation of waste is done, it is covered, the color-coded bins are used so that you are safe in your environment. We have blood safety. We also give blood. We make sure that we screen the blood before we are able to give it. We have equipment safety. Equipment, we use a lot of equipment nowadays because of our digital world. I mean, there are some equipment that make work easier, but we should make sure that it is safe. So what do? We have to calibrate them. We have to make sure that the maintenance culture is followed. You have to make sure that the machine is well enough to deliver the quality of care that you want to deliver. The last one is environmental safety. We have a lot of things that goes on in our environment. For instance, I work in an ICU for a very long time. It got to a point when I get home, I can only hear the sounds of a ventilator. Beep, 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 beep. You sleep and you hear all this because when I go to work, that's the sound that I get all the time. This one, environmentally, I wasn't safe. But what can I do? I have to be able to administer my care. So with this patient safety goal, we'll find a way of reducing these kind of things in order for us to still feel safe so that the patients will get the care that they want to get.